Okay, everyone, welcome to Friday Facts. So excited for you all to be here. We have a really great discussion planned for all of us today. I'm thrilled to jump into it and to introduce our speakers who are going to tell us all about the UNC, the new Parenting with Cancer Clinic. It's actually the Lynn Hall Parenting with Cancer Clinic Fund, and we're going to talk about those different names. Quick announcements. We are in countdown mode to our Joining Our Voices 2023 virtual symposium. That is November 13th through 17th. Information is now on the website, and we have sent information through emails. It is a Zoom link. It's the same Zoom link as this link, so you don't need to register, but please plan to join us each morning, November 13th, 14th, 15th, and 16th from 8:30 to 9:30 for different panel sessions. And then we have on Friday the 17th, I am admitting all of our people, sorry. On Friday the 17th, we have our special presentation at 11 o'clock. So please plan to join us. And with that, I'm going to turn to our speakers because I just want to dive into this. We have Cindy Rogers, who is the Director of Patient Assistance for the Comprehensive Cancer Support Program at Lineberger Comprehensive Cancer Center at UNC, about 5 minutes that way. And Justin Yopp, Dr. Justin Yopp, who is a psychologist and associate professor in the Department of Psychiatry, also at UNC. And I'm so excited to have you both here. I overuse the word excited, but to tell us all about what is going on with the new program. But first, I think I'll turn it to Cindy first, just so you can tell us a little bit about yourself and what you do at UNC and what brought you to this initiative.
Of course. Good morning, everybody, and thank you so much, Heather. Yes, so I am Cindy Rogers, and I, as Heather mentioned, direct the Patient Assistance Program at UNC. I joined the program about 14-ish years ago and have been managing or directing our Patient Assistance Fund since that time. And what that is a charitable fund that helps support our low-income cancer patients overcome barriers to care. So transportation, lodging, food, utility payments, things like that. And it's all funded through philanthropy. So I'm very, I feel like I have the best job in the world because I don't have to raise the money, but I get to give it away and really help folks to not have to worry about whether or not they're going to be able to drive to their medical appointments or, pay their rent that month. So, it's not an unlimited fund, but we do try to help, especially our folks as they come in the door and they're, hit with a cancer diagnosis. You don't usually plan on that. And so help them to get through those first weeks while our social work team works to maybe get other support systems and safety net programs in place, such as, SSI or disability or Medicaid, whatever they might be eligible for, and along with other hospital assistance programs, such as our financial assistance programs that helps with medical bills, unpaid medical bills, and pharmacy assistance. So it's a real team effort to help our folks overcome these barriers, and I'm proud and happy to be part of that. I am an attorney by training and also have a healthcare background. In my previous life, I was a respiratory therapist, and so the meshing of medical and legal is just a real natural thing for me. And so when I started with working within the assistance program, I was meeting folks regularly who also had legal barriers. And so I've been working for the last many years, 12 years, with Legal Aid of North Carolina and UNC Law to help provide basic estate planning documents for patients, and also recognize if they have other things like perhaps an eviction or other foreclosure of a home, those are all things that I can help refer to legal resources in the community. So that's where that's just how my work within that medical legal framework started, and was a segue into our Parenting with Cancer clinic, which we can talk about in a little more detail after maybe Justin gets a chance to introduce himself.
That was great. Thank you so much. And I always try to say something slightly inappropriate. I don't know why. And I was thinking about this and I thought, well, an attorney and a psychologist step into a bar and somehow
right.
help everyone. But all right. So, Dr. Yopp, Justin, tell us about you.
So my name's Justin Yopp. I'm not like Cindy. I don't have all these previous lives and occupations. I'm pretty boring. I am a clinical psychologist. Been at UNC about the same time as Cindy, about 14, 15 years. My training and background is actually in pediatric psycho-oncology, but over the years have shifted more and more toward the adult area. We do a lot of work with adults who are parents and who have young children. So I'm still using my pediatric and child training, but a little bit different way. And I work here at the Cancer Hospital, do a little bit of research, but primarily what I do is see folks who have cancer or people who are affected by cancer and see them for evaluation, support, counseling, therapy as they go through their cancer experience. And people here on this call can certainly imagine why there's folks like me at places like this.
Yeah. Well, thank you. And we do have a lovely audience that has joined us, and I have some questions. And after I ask the really basic ones, like tell us about the Parenting with Cancer clinic, I invite those of you on the call, and I know some of you are wonderful advocates, especially in the cancer space, are welcome to ask questions in the chat as well. So whichever of you would like to tell us about the relatively new Parenting with Cancer clinic.
Cindy, you or me?
No, I think it's up to you this morning, Justin.
I'll go first this round. So the idea for this clinic has kind of been brewing for a little while, and the idea is that if you're a parent and you have cancer and you have young children at home, your cancer experience and your priorities, how you go through that, is notably different than if you don't have children. Not to say one is worse or easier or harder, but it's just different, right? And if you're worried about how your child is doing, how your children are doing, how to communicate with them, how to secure their future, when you have a potentially life-limiting or life-threatening illness. It just matters, right? And I see that in our clinical work, and there's some research to support that, right? Folks who are parents make different decisions on their health care than folks who are not parents of young children. So we've kind of known that, and I've done a lot of work in this area. Cindy did too. And then there was a case last year, at the end of last year, that really crystallized for us that we need to better organize our efforts. I'll go to this quickly, but it was a mother, 40 years old, for the young, early 40s, had 5 children, 4 of whom were minors. Cindy and I were each consulted to meet with her in the ICU. Me, because she had really not communicated with her children about her cancer that much, but certainly not that she was dying. And Cindy was consulted because the custody situation after her death was very murky, unclear, unsettled. So we were both consulted, we both met with her on the floor, but unfortunately, by the time we were asked to meet with her and did meet with her, she was very compromised physically, cognitively. And long story short is that my part in helping her and her family communicate about her, that she was getting ready to die, and Cindy's part in helping secure the custody arrangement and helping to have that be settled, really wasn't able to be done. In part because we were coming in so late. Cindy made some pretty heroic efforts to get a lawyer on board to finalize some papers, but unfortunately she passed before a lot of that could be done. And that case just kind of stuck with Cindy and I, right? It just left a bad taste in our mouths, and it made us think, that, we need to, or we felt incumbent on us to create something where we could, or doctors could, and psychologists, dietitians could refer these parents to us so that we can meet with them earlier in the process. And not just for folks who have terminal prognosis, even folks that have very, rather encouraging prognosis. But create a home where we can meet with parents and their spouses or other loved ones with two broad aims. One is helping them communicate with their children, helping them support their children, and help kind of create an open, honest, developmentally age-appropriate dialogue around cancer treatment and prognosis. And that's kind of my area. And then the other area is thinking about estate planning, custody issues, if there are any, advanced care directives that take on an added meaning when there's children in the home. And that's really under Cindy's bucket. And so helping parents take care of their children now in terms of communication and support, and in the future when and if they're not here. That's really what we aim to do. We think it's very consistent and very much aligned with what's important to parents. And that's been our experience in the 4 or 5 months that we've launched it.
Mm-hmm. Thank you so much. And I'll ask a little bit of a follow-up, and I'll direct it to Cindy. When I learned about this and was sent the link, I want to honor the woman and the family. It's now the Lynn Hall Parenting with Cancer Clinic Fund. Tell us a little bit about how this went from this heartbreaking story to the two of you brainstorming to now it's a clinic and it's a fund that you're able to manage. And I know that I keep giving you leading questions. I know that her son was pretty active in the creation of this as well, if I'm not mistaken.
Yeah, so it was really sort of I want to say stars lining up. It happened very organically. So Justin and I had actually started this clinic, and it so happened that on the day where we presented to our clinical team, we have a weekly clinical meeting, happened that on that day, one of the people from development, from Lineberger Development, was at the meeting, attending the meeting. And she just happenstance was contacted by I think a professor in the business school, with a student. She was connected through this professor to this student who really wanted to donate money and create an endowment in his mother's name. And his mother had been the single parent and raised this really extraordinary young man. And later in life, she started law school at UNC Law and had breast cancer and ultimately passed away from breast cancer. So it just happened that as Justin and I are sharing the story at our meeting, our colleague from development is meeting with this young man to brainstorm how can he set up an endowed fund that would honor his mother. And so it just came together that she's like, aha, I have the perfect place. And so this young man is quite the entrepreneur, and he was able to give an endowment to Lineberger to support this fund, to support this clinic. So it is the Parenting with Cancer Clinic, and it is supported by the Lynn Hall Parenting with Cancer Fund. And we've also subsequently received additional funding now that we've got this clinic rolling and we're seeing patients and we can report some of the outcomes. And we've been able to, our development colleagues have been able to secure additional funding from other sources. So it's great that this is a issue that really can speak to people. And it just really resonates. And so we're very fortunate that we have colleagues in the development area who recognize that and can bring it to their folks who are looking to make a difference and, fund something that is meaningful to them.
It
And
is such, oh yeah.
the only thing I would add to that, Cindy stated very well, is that central tenet of how we've organized this clinic is to reduce as many barriers as possible to parents to accessing what we offer, right? And a big part of that is that we don't charge, right? So there's no bill, there's nothing, we don't charge insurance, there's no copay. And so part of where this money's going is to help fund our time so that we can offer services free of charge. And also because a lot of the legal services that are needed that come up in our consultation, some of them Cindy does, some of them are more specialized and outside of her scope. And so Cindy has done a wonderful job negotiating with a couple of different law firms or agencies, groups, for reduced rates for patients who are financially strapped. And so some of the funds are being used to cover the reduced legal bills so that parents can have that peace of mind and not feel like that their either wills or advance directives or custody issues are being unmet because they can't afford it.
I absolutely love the recognition of the interplay of the medical and clinical and psychosocial and emotional needs with the legal issues. As a family caregiver myself, when I talk about the care team, it quickly went from, well, not quickly, it took a while, but it went from the doctors and nurses and therapists to then the lawyers and the accountants and trying to figure out how to put it all together. And so I'm curious, in our previous conversation also, how unique is this that a medical program, specifically a cancer program, is marrying both the clinical, the psychosocial, with the recognition that there are so many legal issues that are also involved with serious illness?
So as far as we know, and not I want to state this with 100% certainty, but as far as we know, as far as we're able to tell, this is the only effort that is a kind of marriage of a psycho-legal clinic for parents with cancer. So for this particular population, an offering that combines the psychological and legal aspects within a single consultation. As far as we know, it's the only such clinic, which is a little bit surprising because even though certainly psychology and law are very, very different, but there's a lot of overlap as it relates to these patients and especially these parents and securing their child's well-being now and in the future. And I know in a lot of, in years past, when I would meet with patients, oftentimes these kind of legal issues would come up and I would, kind of like, don't ask me. And I imagine Cindy's work, a lot of the psychosocial stuff kind of course, creeps in. And so it seems like kind of an unnatural marriage, but we found over the last 5 months that they actually piggyback off each other really nicely.
Yeah, well, I love it. And for the North Carolina Serious Illness Coalition, let's just continue with the marriage. I think that's what we try to do. We try to bring lots of folks together from different perspectives to figure out how together we can create supportive services and the big picture awareness. A question came in on the chat line, and I have more questions, but I invite others. Our lovely colleague Mary Bethel asked, does a person have to be referred to the program by their physician, or can they just ask for services?
They do not have to be referred. They can ask for services. And we are currently working with a really a remarkable group of students from the School of Public Health at UNC who are doing a capstone project with us and are helping with some marketing and outreach. And so we hope to have some, as we're growing and kind of figuring things out as we go, we're going to have some materials and out where patients will know where to call if, by just picking up a brochure. But for now, we're really working with our medical colleagues, not only the physicians, but nurse navigators. We have a very robust, let's see, they're called oncology patient navigators. These are not necessarily healthcare providers, lay navigators who are contacting some of our patients, when they're newly diagnosed and first coming in the door and assessing their needs, very globally, and they're making referrals for us when they meet families that have children in the home, and along with our amazing social work team who can also make referrals, and other CCSP colleagues. We have a big multidisciplinary group of psychologists, psychiatrists, and social workers who fall under the umbrella of our comprehensive cancer support program. They make referrals as well.
Given the uniqueness of the services that you're providing, what about individuals who may be patients of other health systems? So if someone is at Duke, or we have colleagues here from Biden or Noban, or really if they're getting care for someplace that's not UNC, are they eligible, or do you need to be part of the patient system at UNC?
So I'll say that Cindy and I have taken the stance to, as you said, kind of reduce barriers and be as open to as many people as we can. I think that is the one area where we are limited, in that we are obviously within UNC, we're funded by UNC. There's been a pretty good demand for this service, and so we're not kind of, our slots are more or less usually always filled. So for right now, at least, we are needing to stick to UNC patients.
Sure. Well, one of the ways we have a few minutes left, but I'd love to talk about ways that we can help to amplify your work and promote your work. I wonder if you are in touch with colleagues at other health systems to help motivate them to create something similar. And I know you're so busy at UNC, but I am wondering if there's a way to share it with other health systems, just to see if, hey, this seems to be a really needed. Y'all might want to do it too, especially those big systems that also have law schools attached to them and other business schools.
Yeah, I think that's where we want to get to. I think we're still, we're so new, and Cindy and I, rather than do a lot of planning and needs assessment and all that, we just kind of got started, right? And we're building the plane as we fly it. But we are putting in place some ways to get feedback from patients and get an idea from them if this is as helpful as we have the sense that it is. And so I think once we get those data, and once we have a little more of a foundation to say, this is how you do it, this is what's worked, what hasn't, this has been our feedback from our patients, then I think we'll be in a much better position to amplify what we're doing. Cindy?
Right.
Yeah, I just was going to say exactly that once we get some data that shows that this is, number one, what people want and need, and it's having positive outcomes, then we would feel more confident in promoting it and sharing it with other more broadly. Yeah,
sure. We have some follow-up questions. I want to ask our lovely advocate Parvati has asked some great questions, but a quick clarification about UNC. Is it for UNC patients system-wide, or do they have to be at UNC Chapel Hill?
We've met with some folks from Rex Hospital and others, so I think as long as it's been the UNC family, then that's appropriate.
Great. And then one of our wonderful advocates who was just in DC with myself and Karen Appert talking about the needs of family caregivers, Parvati Krishnan asks, have you encountered concurrent cancers within the same family, parent and child with cancer? And then there was a connected one. Have you tried to connect with the genetic cancer clinics within UNC?
So I'll take that first one. Ms. Kirsten, hi. We have not had any families that have had that, but in the small world category, I didn't even tell Cindy about this, but Cindy, maybe you know, we were asked to meet with someone, and I'm going to talk to the husband today. It's a mother who has cancer, and her 5-year-old child has I think already been diagnosed with 2 kinds of cancers due to a genetic predisposition. And so We've not actually met with them, but they're on board to be we'll meet with them. But other than that, we have not had any of those yet.
Mhm. Well, I know even though she can speak for herself, but given that Parvati Krishnan was with us on Capitol Hill yesterday talking to
Yeah.
legislators about the importance of being connected, especially with families who have cancer throughout, I'm sure she's someone that would be happy to talk with you. And she asked a follow-up question: are you working with patient advocacy organizations as part of your, I'll add, as part of your outreach and education work?
We have not connected with any
Yeah, I
particular
don't know what that
patient
would look like,
advocacy.
but it sounds like it might be a good thing to consider.
Mhm.
And Parvati, you're allowed to speak. I know you're welcome to come off if you want. But that is one of the ways that, as we think about how could the North Carolina Serious Illness Coalition work with you, we do have links to over 200 individuals. They're linked with over 100 organizations. And so how can we help to promote the work? And clearly we are trying to amplify it through Friday Facts, but what can your community partners help you with?
Well, I would be really interested in learning more about that and, how we can help. I'm assuming that would be like a referral to different advocacy groups, or perhaps back to you all who could help connect patients with appropriate advocacy groups.
Mm-hmm, mm-hmm. And that's we'll be talking quite a bit offline, since I know we have a few minutes left. I do want to share, especially with the folks that are on this call, that Cindy, I was able to rile you up in a good way. You are equally passionate about an issue that is really paramount to the North Carolina Serious Illness Coalition, and that is our very complicated legal statutes that affect our advanced directives requirements, that in order to enact a lot of these or some of these documents, we need 2 witnesses and a notary. And through our previous conversation, you shared that is an issue. And so I do want to invite you to rant about that, or let me just say it nicer, to provide some insight into what you're seeing on the ground.
Oh gosh, I could talk all day about that. I just yesterday, I had a call from a mother. Her 22-year-old son was having surgery, and he really wanted to prepare an advance directive. And his surgery was yesterday at 10. Could I meet them at 9 in the morning so that he could prepare an advance directive ahead of time? So we really didn't have time to have a in-depth conversation with a 22-year-old who, I would have approached it very differently if we had the appropriate amount of time. But yeah, so here's this, young man who's clearly scared, and I'm meeting him in our resource center in the cancer hospital and having to run around and find volunteers or other patients or other caregivers who are wandering around in the lobby to be a witness. When, and people are usually very kind, and but I have a little package spiel that I give on, this is a weird question, but this is what I'm doing, and would you mind? And most people will say yes, sometimes no. They're uncomfortable signing something that's legal in nature. So it's a big impediment, and very difficult for our inpatients. Similarly, I'm called to see inpatients who want to execute advance directives. And then we're again now asking other visitors to other inpatients to come, and using nursing staff to look for those folks. And then we've got our folks in the community, where in the past I've been saying, well, this needs to be notarized. You need to go to call your bank and see if they will notarize this for you, but bring a friend or two. And I recently learned that the State Employees Credit Union wasn't notarizing healthcare documents any longer. So I don't know if that's statewide or if that was just that particular branch, but it's just a big impediment for people being able to do this work.
Well, thank you. Thank you for the insight, and thank you for the offer that when we had talked previously to help with our advocacy efforts. I think your story and your experience is so powerful, and to help our legislators hear that, and that you had offered to talk to anyone about that. And I'm not sure what everyone is doing tomorrow, Saturday, but if you want, you're willing to join, and you can join me at Durham Tech Community College, because I'm spending all day to become a notary myself, so I can help individuals. We have just a moment left, but we have another question that's come in the chat line from Meredith Jones. If you have attorneys who are willing to work at a reduced fee for similar type of work through other programs, I would love to learn more about them, with their permission, of course. I am on the hospice side, where parents have not yet put plans in place for their children, and there's a pretty intense scramble trying to get those legal resources for those with limited resources. Thanks for the amazing work you all are doing.
So I'm working on that. I would say that that's definitely a work in progress. I have a relationship with Legal Aid of North Carolina, where they've sort of carved out, and this is a long-standing relationship now, 12 years, where they will help with patients that I've referred to do financial powers of attorney. But with regard to the things like custody or guardianship and wills and trusts, that's a harder nut. So I have spoken with, there's a nonprofit law firm in Durham who will see patients or clients at a reduced rate based on income. They have sort of a sliding scale. That's called Bull City Legal. And there's they will, what they do is they contract with attorneys in different areas of specialty. So they do contract with some attorneys in the estate planning realm and can offer low cost estate planning services. And then I just call, I just have a few attorneys I know through our volunteer program who I'll call, and try not to abuse that too often, to provide pro bono services for folks. But there isn't a real solid network in place, but I'm working on it.
Okay, well, and hopefully we can help with that as well. I cannot thank you enough. We are at time, we're a little bit past it, but we wanted to keep this discussion going. And so many thanks to Cindy Rogers and Justin Yopp. And I want to end with a lovely comment that came through on the chat, which is, it's really wonderful to see UNC lead the way, especially as a double Tar Heel myself, but really that you are modeling about the different ways we can support each other and the different kinds of support, especially those with cancer and other serious illness. So cannot thank you enough. The two of you plan to be well connected into the North Carolina Serious Illness Coalition. We plan to stay well connected with your work, and really thank you so much for all that you're doing.
Sounds great. Thank you, Heather.
Thanks for
all
the
right.
opportunity.
Thank you, everyone.